Welcome to Strike Stroke. My name is Dr. NIHSS. Let us continue our talk on the National Institute of Health Stroke Scale, shortly known as the NIHSS Stroke Scale. The NIHSS Stroke Scale is a standardized tool used to quantify the severity of stroke an individual is having and help guide in treatment. It is meant to be objective and reproducible. Today we're going to look at the eighth component of the NIHSS Stroke Scale, called sensory. As humans, we have sensory for vision, smell, taste, sound, sensation of where our body is in space or our body movement in space, which is called proprioception, sensation of balance, which is vestibular sensation, tactile sensation, painful sensation, sensation of temperature, hot or cold. The ultimate reason for having so many sensing modality is survival, at least according to me. And if we like a certain type of sensory input, we tend to seek for that because it brings us pleasure, and it makes sense. And if you believe in the creation story, which I think is a beautiful story, we were created, put in the Garden of Eden, where we were meant to be kings and queens, know pleasure, comfort, and luxury, and have no want. But let's get back to the topic of sensory and the National Institute of Health Stroke Scale. This section is looking for sensory deficit or sensory loss due to stroke. It is important to remember that sensory loss can be partial or could be complete. The severity of a sensory deficit depends on the severity and the location of the stroke. When we're doing sensory testing on the NIHSS Stroke Scale, what section of the brain are we testing for? This section is testing for the somatosensory cortex. How is sensory tested during stroke code? During stroke code, the examiner, either using light touch or painful stimulation, will examine the individual's ability to perceive and respond to sensory stimulation. How does the examiner determine to use light touch or painful stimulation? This depends on the level of consciousness of the individual involved in a stroke code. If the individual is awake, alert, and able to communicate with the examiner, then the examiner will use light touch to assess for sensory. But if the individual is stuporous, meaning repetitive stimulation is required to have him engage in physical examination, or if they're comatose, then painful stimulation is required to assess if they can perceive and respond to sensory stimulation. Sensory examination involves the face, the arm, and the legs, and the examiner will test each section separately and compare it to the opposite side. For example, if the individual is using light touch under the appropriate setting, then they will touch the right portion of the face and ask the individual if they feel the touch, and then they will compare the left side of the body and ask them if they feel the touch the same way. If the individual says, no, I feel this one differently, or I feel them the same, or I feel nothing, then the examiner will score appropriately. If the individual has low level of consciousness or has aphasia, difficulty in communicating, then either pinprick, where the individual uses a sharp object, not too sharp, not to cause skin breakage, but they will use either pinprick testing or pressure on nail bed to see the individual's response, either with grimace or withdrawing from the painful stimulation, and will compare one limb to another and record their findings. This section is scored on a scale of 0 to 2. 0 means no sensory loss. The individual is able to sense both sides equally. 1 is given to an individual who has mild to moderate sensory loss, meaning the individual will say, I feel the right side better than the left side, left face, left arm, left leg, when compared to the right side. If the individual has decreased level of consciousness or has aphasia, or difficulty in communicating, then this individual might get a score of 0 or 1. A score of 2 is given to an individual who has total sensory loss. In this case, in an awake individual, they might say, I don't feel you touching me on the right side at all, right face, arm, and leg. Or the individual could be comatose, then they will get a score of 2. As we mentioned earlier, this section is testing the somatosensory cortex, and most of the time, individual will report sensory deficit on one side of the body, which is typical for most strokes. So the individual might say, I have decreased sensation on the left side compared to the right side, or no sensation on the left side compared to the right side, involving face, arm, and leg. But it's possible for an individual not to have any sensory involving both part of the body. The answer is yes. If the stroke involves the brainstem, the individual could have loss of sensory input on both parts of the body. Thank you for watching. I hope you found this information useful. On the next episode, we'll talk about the 9th component of the NIHSS stroke scale. Always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.